Welcome to another episode from the Veterinary Research Channel. Today, we delve into a critical area of canine health, meningoencephalitis of unknown origin, often referred to as MUO. This term encompasses a group of inflammatory brain diseases in dogs that can only be truly distinguished by examining tissue samples under a microscope. These conditions include granulomatous meningoencephalitis and necrotizing meningoencephalitis. Despite ongoing research, the precise causes of MUO remain unclear. However, current understanding suggests that an immune-mediated process likely plays a significant role, evidenced by the presence of inflammatory cells and autoantibodies in the brain. Given this presumed immune basis, the primary approach to treating MUO has been immunosuppression. Veterinarians commonly use corticosteroids and other drugs that suppress the immune system, such as cytosine arabinoside, leflunomide, and cyclosporin. Despite these available treatments, a definitive, superior treatment protocol for achieving remission in dogs with this challenging condition has remained elusive, and the prognosis is often guarded. Sadly, many dogs affected by MUO succumb to the disease or are humanely euthanized within the first few months following diagnosis, highlighting a critical period of increased mortality immediately after the condition is identified. Previous research has provided some insights. For instance, one study indicated that dogs treated with immunosuppressive doses of corticosteroids showed a median survival time of over 600 days, supporting the use of prednisolone monotherapy in managing this disease. Another common practice involves adding cytosine arabinoside to corticosteroid therapy. However, the effectiveness of this combination has been a subject of debate. One study suggested that administering cytosine arabinoside as a continuous intravenous infusion at the time of diagnosis improved 3-month survival rates compared to subcutaneous injections. In contrast, another study found that adding cytosine arabinoside to cyclosporin and prednisone at the time of diagnosis did not lead to better outcomes in dogs with MUO. Regardless of the chosen treatment, the survival rates vary considerably, and unfortunately, some dogs continue to worsen despite receiving treatment. Researchers have identified several factors associated with a poorer prognosis, including the presence of seizures, lesions affecting multiple areas of the brain or the brainstem, and specific findings on magnetic resonance imaging, such as evidence of fluid-filled lesions with low signal intensity on T1, weighted images, which may indicate tissue death and are more suggestive of necrotizing encephalitis. More recently, it was found that obtundation, a state of reduced alertness, is a significant risk factor for early euthanasia in these dogs. To date, there has been a lack of prospective, randomized studies directly comparing treatment with corticosteroids alone versus a combination of corticosteroids and a continuous intravenous infusion of cytosine arabinoside for MUO. Therefore, a recent study set out to address this gap in our knowledge. The primary goal was to compare the outcomes at 7 days after diagnosis in dogs treated with corticosteroids alone to those treated with corticosteroids and a continuous rate infusion of cytosine arabinoside. Secondary objectives included comparing outcomes at 30 and 100 days between the two treatment groups and documenting any complicating factors, such as how well owners followed the treatment plan and any changes made to the medication by referring veterinarians. Now, let's move on to the findings of this important study.
As we continue our discussion on the treatment of meningoencephalitis of unknown origin in dogs, we now turn our attention to the results of the study we introduced in the first half of our podcast. This research involved 69 dogs that were diagnosed with suspected MUO based on magnetic resonance imaging and cerebrospinal fluid analysis, or both. These dogs were randomly assigned to one of two treatment groups. The first group, consisting of 35 dogs, received corticosteroid monotherapy in the form of prednisolone or its equivalent dexamethasone. The second group, comprising 34 dogs, received a combination of a lower dose of corticosteroid and a continuous rate infusion of cytosine arabinoside. The researchers primarily looked at the proportion of dogs in each group that experienced treatment failure within the first 7 days. Treatment failure was defined as either death or a worsening of their neurological condition. What they found was that in the corticosteroid-only group, 7 out of 35 dogs, or 20%, experienced treatment failure within this initial period. In the group receiving the combined therapy of corticosteroid and cytosine arabinoside, continuous rate infusion, 8 out of 34 dogs, or 24%, experienced treatment failure. Statistical analysis revealed that there was no significant difference in these proportions between the two treatment groups at the 7-day mark. Looking specifically at mortality within the first 7 days, 4 dogs in the corticosteroid-only group and 4 dogs in the combined therapy group died. It is worth noting that 2 dogs in the combined therapy group died due to cardiac arrest before even receiving the cytosine arabinoside, and 1 dog in the corticosteroid-only group was euthanized by the owner's request shortly after starting treatment. Interestingly, when dogs in either group deteriorated within the first 7 days, they were allowed to receive the other treatment protocol. 3 dogs initially in the corticosteroid-only group received cytosine arabinoside, continuous rate infusion, and subsequently showed neurological improvement. Similarly, 4 out of 5 dogs initially in the combined therapy group who received additional corticosteroids also improved. Moving beyond the initial 7 days, the researchers also compared outcomes at 30 and 100 days. At 30 days, 9 out of 35 dogs in the corticosteroid-only group, or 26%, had experienced treatment failure, compared to 11 out of 34 dogs in the combined therapy group, or 32%. Again, no statistically significant difference was found between the groups at this time point. By 100 days, the proportion of dogs that had died or deteriorated was 15 out of 35, or 43%, in the corticosteroid-only group, and 23 out of 34, or 68%, in the combined therapy group. While this shows a numerical difference, the statistical analysis indicated that this difference was approaching but not reaching statistical significance. Finally, the study assessed overall mortality at 100 days. 9 out of 35 dogs in the corticosteroid-only group, or 26%, had died, compared to 12 out of 34 dogs in the combined therapy group, or 35%. Using survival curve analysis, the researchers found no significant difference in all-cause mortality at 100 days between the two treatment approaches. They also noted that the majority of dogs did not adhere strictly to the planned tapering of corticosteroids after discharge, often due to adjustments made by referring veterinarians or owner requests. Furthermore, many dogs in the combined therapy group only received the initial infusion of cytosine arabinoside. The researchers concluded that their study found no significant difference in outcome between corticosteroid monotherapy and the combination of cytosine arabinoside, continuous rate infusion, and corticosteroid therapy at 7, 30, and 100 days after diagnosis in dogs with meningoencephalitis of unknown origin. This suggests that the addition of cytosine arabinoside, continuous rate infusion, to initial corticosteroid treatment does not necessarily improve the immediate or short-term outcomes in these cases. While survival analysis at 100 days also showed no significant difference, the researchers acknowledged that it was harder to interpret long-term effects due to the lack of control over treatment after the dogs were discharged. The potential for cytosine arabinoside to reduce relapse rates in the long term could not be adequately assessed because most dogs did not continue with further infusions. This important question warrants further investigation. The finding of no significant improvement with the addition of cytosine arabinoside aligns with the results of a recent retrospective study comparing corticosteroid-only treatment to a combination protocol, as well as another retrospective study examining the addition of cytosine arabinoside to cyclosporin and corticosteroid therapy. One possible explanation for the lack of a significant benefit from the cytosine arabinoside continuous rate infusion in this study could be the limited information available regarding the optimal dosage of this drug in dogs with MUO. The most effective therapeutic dose remains unknown, and it is unclear whether achieving higher peak concentrations or maintaining concentrations within a potentially therapeutic range in the central nervous system for a longer duration is more beneficial. However, this study specifically aimed to evaluate a commonly used treatment protocol involving a specific dosage of cytosine arabinoside, continuous rate infusion. The study also considered factors known to influence prognosis, such as the presence of obtundation and magnetic resonance imaging features suggestive of necrotizing encephalitis. They found similar numbers of dogs with obtundation in both treatment groups, so this was unlikely to have skewed the results. Similarly, a small percentage of dogs in each group had MRI findings suggestive of necrotizing encephalitis, and surprisingly, all of these dogs improved and were alive at the 100-day mark. This observation challenges the notion that dogs with necrotizing encephalitis invariably have a worse outcome, which is supported by recent findings suggesting considerable overlap between different types of MUO. It is important to acknowledge some limitations of the study. Histopathological diagnosis was not achieved in most cases, meaning that dogs with other conditions, such as neoplasia, might have been inadvertently included. However, the researchers did not believe this introduced substantial bias, as such cases were likely distributed equally between the treatment groups. Additionally, repeat investigations were not routinely performed when a relapse of neurological signs was suspected, so other underlying conditions could not be entirely ruled out. Encouragingly, the study did not observe any major adverse effects directly attributable to either treatment protocol, and both cytosine, arabinoside, and corticosteroids appeared to be generally well tolerated. The main side effects reported by owners were those typically associated with corticosteroid use, such as increased thirst, urination, appetite, and skin changes. These were generally manageable, although one owner requested an earlier reduction in corticosteroid dosage. In dogs considered at higher risk of gastric ulceration due to high corticosteroid doses, such as certain breeds prone to regurgitation, gastrointestinal protection was provided. The researchers highlighted the challenges of maintaining blinding of the clinicians to the treatment groups and ensuring adherence to the protocols throughout the study. While the study was not fully double-blinded due to the need for the primary clinician to discuss the risks of cytosine arabinoside with the owners, the use of a blinded clinician for neurological scoring helped to prevent premature deviation from the assigned treatment. The neurological scoring system used in this study, while valuable, has not yet been formally validated, although a similar tool has recently been published. To strengthen future research, the researchers suggest continuing the blinding of treatment allocation during data collection for the primary outcome to further minimize potential bias. In conclusion, this well-designed, randomized controlled trial provides valuable insights into the initial management of meningoencephalitis of unknown origin in dogs. While it did not demonstrate a benefit of adding cytosine arabinoside continuous rate infusion to corticosteroid therapy in the first 100 days after diagnosis, further research is needed to evaluate the longer-term effects of this combination. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.